Do you have trouble moving your rib cage? Did someone tell you that you need to activate your obliques through moving your rib bones or breathing out, but you have trouble with it because you tend to over tense or just having difficulty activating or moving the rib bones? If that's the case, this video is for you. And I'm going to talk about a very quick cue, a simple kind of way to think about rib bones, so it's hopefully simple enough that you can create some form of difference. So let's get right into the video.
Hi, this is Kento at Kamiyama Physical Therapy. Welcome to our channel.
So let's talk about the rib bones. So the rib bones are attached to the side of your spine, from the thoracic spine, basically from the upper back to the mid to lower back. And it is a ring that goes around and attaches to your sternum. The lower one attaches through the cartilage into the sternum. And when you move the rib cage, the front part of the rib cage tilts down and the back part of the rib cage goes up. So it kind of goes through this tilting motion. And during some motions, when people try to move the rib cage or try to activate the obliques, what happens, they kind of dump their spine into flexion as they do it. Granted, if you move your rib cage, it eventually may flex the spine as an eventual thing, but to move the ribs more independently, there's a simple cue that we can use to hopefully help you feel the rib bones and hopefully your whole abdominal core well. So whenever you are bringing down here, what's happening here, there's a spinning action that's happening into the rib bones, which is this, right? So the front part, this is the front, this is the back. The front goes down as the back goes up, so it kind of creates this spinning action. So whenever you are rotating or spinning something, you have an axis, meaning there's a center part that it revolves around to allow things to rotate. So for example, if I'm rotating like left and right in this video, I'm at this point it's automatic, but I'm assuming there's an axis that's pointing straight in the middle of my chest, and I'm letting rotation to happen on the central axis. But if my axis is in the front, let's say my axis is not in the middle, but like in front of my chest, what I'll have to do is I'll have to kind of go around kind of this axis to rotate, which will become a not as clean of a rotation as we think. So when a person is dumping their spine forward when they spin, their axes might be in the back more, which kind of dumps everything forward to create rotation. So another easy cue to think here is to imagine that the center of axis is kind of like in between, like in the middle. It's like a little lower than your armpit and right in the middle. So between the front and the chest in the middle. And that's the axis as you breathe out. So instead of keeping here the axis and rotating, you're going to keep it right here as you breathe out. So what happens here is my rib bones are still stacked over my pelvis as I spin in this drill. So this allows or decreases the ability for the spine to flex as you compensate and really work on the spinning of the rib cage as you drill. So what this could also mean is that you don't need as much movement as you think to get this rib motion. Sometimes when you do too far, too much too soon, and you do fast, it can dump things into the system. So be slow, just imagine the cue. So you can notice there's a little bit of drop in my front part of the rib cage, and then the spine doesn't flex too much. It flexes gently. So I hope this is helpful. Know that this is a cue, an external cue to try that out, and then note the feeling you get from it as you do it. And that is what we're gonna need, that ingredient you need in order to work and transfer into different type of activities. So remember how it feels once you get it. Don't just remember the axes, just remember how it feels, and then you can transfer into different activities because you can remember it through some feels, how things are feeling as you move. So I hope this is helpful. I'll see you in another video.